Tonight, we are talking about bipolar disorder. It's on our radar this week because a celebrity confronted her own situation. Catherine Zeta-Jones checked into a psychiatric hospital.
We just battled through.
The battle against Michael's cancer, that is. Then there was the lawsuit from his ex-wife and his son being sent to prison. All of that plus 2 young children. What a year. The intense stress took its toll on Catherine Zeta-Jones, aggravating her bipolar 2 disorder. 6 million Americans have it. Countless families feel the effects. You are not alone. Let's get rid of the ridiculous stigma. Bottom line, this is a medical issue. I'm going to help you understand it, the warning signs, and what you should do. It's time to get the facts and get down to the business of understanding bipolar disorder. All right, that is what I want to do here. I want to examine this in ways that's not done elsewhere on the media. So before we go further, let me tell you what this thing is we call bipolar disorder. It used to be called manic depression or manic depressive disorder. It is a brain disorder. The hallmark is intense mood swings. It is a mood disturbance. Manic are what's called hypomanic highs. People are inflated. They don't need to sleep very much. They are hypersexual. They have inflated ideas about themselves. And depressing rock bottoms, lows. It usually develops in teen or young adulthood. Joining us to talk about this condition is Oscar-winning actress and mental health advocate Patty Duke. Patty was diagnosed with bipolar disorder at age 35. And Maurice Benard is here. The General Hospital actor has publicly battled bipolar disorder as well. Thank you guys for being here. Patty, I wanted to start with you. You knew at a young age that something wasn't right. What did you first feel? What did you first see? And how did this come to light?
I must tell you that part of the cover for my illness to the public was the roles I played. Having played Helen Keller, where I beat up a grown-up, that was very therapeutic for me, but it was not the absolute answer. I went at my early 20s. The manifestations started with the depression. Didn't get out of bed for months at a time except to go to the bathroom or attempt suicide. Then the surge upward would happen. And then I spent all of my money and anybody else's that I could and did things that were really kind of scary, such as marrying someone I did not know. Which was annulled 13 days later. But these should have been, to me, examples of something very wrong, and that was a medical condition. It wasn't until I had the good fortune at 35 to be going to a psychiatrist at the time and kicked into an up time. And the doctor was able to diagnose because he had seen me in the downtime. And that wasn't until I was 35. So I wasted a lot of years by not going for help sooner.
Yeah, I want to point out to people that it's very common for bipolar patients to be treated as what's called unipolar depression. And sometimes antidepressant medicines can kick somebody into a manic episode. That's how the doctor then makes the diagnosis. But the treatment for bipolar, medical condition with a medical solution, is different than the treatment for unipolar or the kind of depression that people think about characteristically. Now, Maurice, you play a character on General Hospital who apparently suffers from bipolar disorder. It's like art imitating reality, reality imitating art. Let's check this out.
Can you tell me how old you were when you realized you acted different from other people? I mean, I know you weren't diagnosed until you were an adult, but can you ever remember getting angry for no reason, even when you were my age?
Are you really doing a school project, or for whatever reason, you think you might be bipolar?
What do you think when you see that? Were they creating that storyline because they knew you were struggling?
Well, yeah, when I first started the show, you know, I was making choices like the character was, at that point, manic depressive. And they started talking to me, the writers started talking to me about my own life, and they started incorporating it into the role. And they even did a storyline where Sonny, the character, has a breakdown and then goes to a psychiatrist and gets help.
Did Maurice, go get help? Did anybody suggest that? It's great they're creating a story around the character, but did somebody look after you?
Well, you know, the reality is I've been taking my medication now for 20 years straight, so I was cool. But I got to be honest with you, at the end of the storyline, my wife had to call them and say, let's stop this, because at the end of it, I had an anxiety attack.
It's too close to home.
Yeah, it got too close. It went on too long, and I couldn't kind of shake it. You know?
We actually have a viewer call. This is Jamie. She is in West Virginia. Jamie, what's your question for the panel here?
Hi, Dr. Drew.
Hi, Jamie.
My concern is I suffer from bipolar type 2 rapid cycling myself, and there's also a family history of mental illness.
Of course.
And I'm wondering how genetically predisposed are my children to this disease?
Two interesting questions here, and one thing we need to clarify. We've not yet really clarified what bipolar 2 is, which is what Catherine Zeta-Jones has announced she has, which is let's say it's a milder form of bipolar where there's at least one episode of hypomania, but not true mania. Mania is people can disconnect from reality sometimes. Hypomania, they're inflated, but they still are not psychotic. They're not disconnected from reality. Patty, do you have an answer to that, the genetic predispositions?
I do. I believe that it is that the theory that it's a genetic illness is true. My mother may have been unipolar, but she may have been bipolar because her behavior wasn't examined when she was in her up and angry state. I have children. I have grandchildren. I feel good that we know enough about this now that if symptoms begin to show, we can help that person go for help. So far, we haven't had it yet, but I'm not counting us out.
Well, right. It's a medical condition like any other medical condition that can emerge during our life. And treating it early actually reduces the severity of the illness. Maurice, are you worried that your kids might have it? Do you feel guilt, or I imagine that's a very concerning thing for you.
I don't worry about it, but I know that if I saw the symptoms, I could catch it early because of my own experience. But, you know, there are times that my wife and I talk about it and we think, you know, what if? But I think, you know, with treatment, you can live a great life.
Maurice, I think we're going to say farewell to you. Do you have any messages to my listeners or my viewers that might be struggling with this?
You know, basically the message is, if you feel you have any kind of symptoms, seek help, get treatment, and stay on your medication.
Yeah, stay on the medication. It is a big one. I think you learned that one the hard way, but that's a very common challenge for those of us as physicians to get people to do that, and we're going to talk about that. When we come back, we actually have a young woman with bipolar disorder who wants our help. We're going to talk about why she hid this problem from family and friends. We are back talking with Patty Duke about bipolar disorder, and I really want to be sure this is sort of accessible material for people. People are hearing about it a lot now with Catherine Zeta-Jones and her story. It's an easy thing to get your head around. I hope this is the place you'll get your information about it. We're going to ask questions of Diane.
Doctor?
Yes, ma'am. Patty's interrupting me. Go right ahead, please.
I'm so sorry. I can't help but interrupt you because I hope that you recognize the public service that this show is. The way you're dealing with it, the way you are explaining it to us in detail, doesn't happen other places. So thank you.
Well, thank you, Patty. I appreciate that. And I know that. And as a doctor, I know how common this thing is, and I know how important it is to get the word out. There are people out there with it that don't know they have it. There are people out there that know they have it who are resisting treatment, which is exactly why I asked Diane Gilmet to come in here. She was diagnosed 2 years ago, and she hid her problem from family and friends. Got to figure out why that. And again, we're trying to address the stigma as well as helping people understand what this thing is. And Carrie Bearden, she is an expert when it comes to bipolar disorder. She does research. First, before we go to our new panelist, I want to go to a Facebook question. This is from Michelle S. She reached out to us, and she wants to know, do you have to stay on your meds for the rest of your life if you suffer from bipolar disorder? Patty, you kind of tipped your hat to me on this one a little bit when I brought it up during the commercial break. I know you have some strong feelings about compliance, so let's get to it.
I do. Okay, first of all, the word compliance could be one of the off-putting things about it. Yes, As a patient of almost 30 years, I have taken my medicine every day. I do not miss it. You get to feel well, and so you think, oh, I don't need this junk anymore. That's not right, and it's kind of a silly thing to worry about. For all of our problems, that's pretty much the least. The other thing is I wanted to let you know that recently I started to feel kind of wonky. I wasn't sure what it was. Maybe it was depression. Maybe, I mean, there were a lot of things in the world to be depressed about, but this was above and beyond that. So I swallowed my pride and went to the doctor, and my medication has now been tweaked. That means a different medication has been added. And I must tell you, in the last 35 days, I feel so much better, and I'm grateful for the people who have encouraged me to keep up my meds.
And Diane, that's really one of the points here, which is that it's a condition that goes across the lifespan, and it can be something that people aren't too happy about speaking up about. That was your story, yes?
Right, very much so. It's the stigma that's attached to it. You don't want to be categorized in this group of now I have to take medication every day.
Did you even know what they were talking about when they said you have bipolar disorder?
I had suspected for many years because I would have very low points and very high points. And, you know, as my mom has described, when I'm on, I'm great. But when I'm down, I mean, there are times when I won't get out of bed, I won't eat, I won't shower, I won't change. There's just nothing that I feel motivated to do.
Do you still feel the stigma, even though you understand how biological and medical this condition is?
I know my mind wants to tell me that it's just a medical illness, but still, I haven't been very open with most of my friends or family, and it's still I have to take medication for this. I have been in the hospital for this, and if you had diabetes, you wouldn't be ashamed to tell anyone. You wouldn't be ashamed to carry insulin around with you. But yet, when people see my medications in my purse, you feel like you want to tell them, "Oh, that's just for my blood pressure. It's just something else."
Carrie, any
and there's
sense?
still this shame.
Yeah, why that is? Oh, wait, Patty,
Traveler,
please.
as a fellow traveler, I had a very, very, very brief time of, oh God, somebody's going to find out.
Yes.
I then recognized that I was in a position, my celebrity would be helpful in getting the word out, and that became my passion. It doesn't have to be everybody's passion.
No.
It's your business. But I wish that you would take the stigma away from your medicine.
Well, that's why I'm so
There's
grateful
nothing
for
to
you.
be-
For you making it public
love
and making
you.
it well known. And people like yourself and for Catherine Zeta-Jones for making this a public thing so that people do become more aware of it and that it becomes something that is not something to be shameful to speak of.
Carrie, let me go to you next because I've got a million questions about
Precisely.
how common this thing is, how many people get treatment, how many people stay on treatment. Why don't we stay there?
I think it's a great question. So about 1 in 100 people have bipolar 1 disorder, which is the most severe form of the illness. But there's probably another 2 or 3% of people that have a spectrum of illnesses. And there may be even more that have milder forms of the illness, cyclothymia, which is basically mood swings that don't meet the full level of severity for a bipolar diagnosis.
How many of those come to treatment?
How many of those come to treatment? The 1 in 100 figure that I'm citing are really people that have come to treatment that have gotten the diagnosis. There may be many more people out there. I think it is an underdiagnosed condition.
And how many stay on treatment? This is what Patty's talking about. She loves the word compliant, so I'm going to use it because I'm a doctor. I get to use disgusting words.
You're a devil.
What percentage stay with it? Because this is the problem as a physician, again, getting people to stay with their meds. For the very reason they don't want to believe they have it, or I don't know what it is. It's very funny.
It is really, this is one of the most confounding things about treating this disorder is really that more than 70% of people will discontinue their medication at some point during their course of illness. And I think there are a lot of factors, and I think one of them is just not having good communication with your doctor.
Well, God knows our healthcare system functions so well and so smoothly, I can't understand why the doctor-patient relationship is being broken down. Let's go to a phone call. This is Nancy. She is from Florida. Nancy, what's up?
Hey, I you know, this is an awesome, awesome thing you're doing, only for your true sincerity on this. So thank you. And, you know, when this all comes about and you share it with the ones closest to you, your family, the problem is it's like all of a sudden it's like you're crazy. Or, you know, and no matter what you do, you still have that stigmatism attached to you. And they make you, and somehow the family members, some of them, they just make you feel shamed, and you're just not really, they treat you differently. And I don't really understand that
I'd take a vacation from those family members.
What's that, Patty?
I said I'd take a little vacation from those family members.
Yeah, well, you know, that's very much to the point. I mean, that sounds more like a family systems problem than a problem with bipolar. If somebody's going to shame you and use your medical condition against you, that's coercive, and that's sad. But I got to say, Nancy, it's a good question because I noticed that Diane actually responded to it. She's saying, oh my gosh, that's what's going to happen to me if I admit it to my friends. They're going to hold it against me. They're going to use it against me.
When is Diane going to go crazy?
Oh, Diane's a crazy person.
She's going to go crazy.
How do the people deal with that, Carrie?
Careful, she's going to get depressed. Yeah.
Well, and let's be fair that some people with bipolar are brittle. They're very fragile, and but that's not the most common thing, is it, Carrie?
Well, it's a challenging issue because a lot of people, the family members will report that they feel like they're walking on eggshells all the time, that they are going to trigger something, and so I think that there's some truth to that for some people, but I think one of the biggest things about the treatment is really getting the whole family involved in treatment, and family-focused therapy is really effective for not just for people with bipolar disorder, but also for children of parents with bipolar disorder, and really helping understand what their parents are going through. So,
and it's like addiction. It's disconnecting the person from the disorder and helping them understand they don't need to walk on eggshells. And if they are walking on eggshells, it's probably because the disorder is not completely treated
it's
yet.
not completely
not
treated.
thoroughly under control. If somebody's irritable and intense and aggressive or excessively depressed and has trouble functioning, that's inadequate treatment. If you're still having symptoms, that means that the disorder is not completely and thoroughly treated yet. You've got to keep going back and get the treatment. You can expect complete remission. I want to thank our panel. Diane, thank you for being so courageous. I know if you have any repercussions, please let me know. People now are going to know about this.
Thank you, yes.
Carrie, thank you for joining us. I really appreciate it. And
My
Patty,
pleasure.
God bless you. Thank you so much for doing this.
He does.
yes, thank you.
Thank
From
you,
someone
doctor.
in the mental
You're-
health
you're
field,
who
I think
we
it's
need
so
out
important.
there.
Thank you, Patty. And I think we will all agree. I want to thank Catherine Zeta-Jones for coming forward with this so we can talk about this. She has done something important for millions of people. When we come back, what about if you're taking meds for bipolar disorder and you have an addiction? That's something I can answer, and more of your questions after this. Welcome back, and thanks to each and every one of you who has contacted us. It's time for your questions, and we are first up going to go off into Facebook. I like that because it helps me use my new toys here. There is our Facebook question. It is from Michael P., and he asks, what is the worst thing a bipolar person can experience? And let's be clear, the worst outcome from bipolar is death. Suicide is very common in bipolar patients. And what I think is counterintuitive and needs to be pointed out is that a bipolar patient actually statistically is more likely to kill themselves, suicide, when they're manic. The misery of mania is actually what triggers more suicides than the depression, which is what we more commonly think about as something that's going to cause a suicidal thought. So, bipolar disorder must be thoroughly treated. We have James. He is from Indiana. He's on the phone. What is up there, James?
Hey, Dr. Drew. How you doing?
Hey, buddy. What's going on?
I was diagnosed with type 2 bipolar disorder,
Yep.
and there's occasions where I go on and off my meds. Is there going to be any adverse effects of that?
Right. I think you're asking whether or not there are any medical consequences of going on and off. Are you going to hurt other organs other than your brain? And not really. That's not the big issue. The big issue, my friend, is that you have a dangerous condition that you are determining how to treat, not taking direction from a doctor. So you can expect the worst possible outcomes in terms of your bipolar disorder. Please, if you go on and off, just do it with the supervision of a physician or a psychologist who can really watch what are really pernicious and subtle symptoms that can come on when you're off your meds. We had Maurice here early in the show. Every time he went off, he had a major, major breakdown. It's a serious thing going on and off, but no, you're not going to cause other organ damage or other medical conditions, but you certainly aren't being managed properly. We've got also Shannon. She is on the line. She is from Washington. Shannon, what do you got for me?
Hi, Dr. Drew. My question is about addiction and bipolar disorder.
Go ahead.
I've had addiction problems in the past. I've been sober for a couple years now, and I've had problems finding a provider who can deal with both.
Yeah.
I've had a psychiatrist who doesn't want to even see me in her office when I was using, and then my addiction counselor who doesn't want to address the bipolar
Right.
because it's not her
I
area.
totally, completely understand. This is a very common thing. People with addiction are actually more likely to have bipolar disorder, either caused by the addiction by messing with the brain chemistry, or people with bipolar disorder are actually also a little more likely to have addiction than the average population. So it's a real serious issue. I'm not sure I can answer it in a way that's going to be that satisfying for you, except to say benzodiazepine medicines are very common and effective for bipolar patients, but they, in my opinion, are a no-no for bipolar with addiction. So be careful about that. Secondly, there are psychiatrists and internists out there and family practitioners that are trained to handle both. You want to look for somebody that's board certified in addiction medicine, and just make sure, I think, just make sure you're going to your 12-step meetings, have a sponsor, and keeping the basics while you see an expert in mental health like a psychiatrist who really should really manage the bipolar disorder separately. Really is two separate things that need to be managed separately.